There is absolutely no question. I mean, I think that this is fundamental. I think that you've done an incredible service for those of us that are new to simulation and new to the more administrative position here. I don't think that I would be able to take our center to the next level, and I've been tasked to do that with my position without this type of support and resource, and I haven't been able to find anything else in the market that offers this kind of support. So I think that anybody who has come into this field and anybody that's in upper administrative positions should send their administrative people running their simulations here. I think if you don't, you're not going to be as successful as you can be.
To HealthySimAdmin. Really, we just opened 6 weeks. Our doors just opened, so we have quite a range of new simulators, and so we have all the high-tech equipment. We have a fancy new center. However, we don't have those skills and knowledge at this point to really make the knowledgeable decisions as far as policies and procedures. Funding and external contracts. We really needed advice from experts who have been in simulation for years and providing us guidance that we really need at this point in our growth.
I came to this conference because I think there's a huge gap between what administration on higher levels believe simulation is versus people that actually work in simulation and try to make it work on a day-to-day basis. I think that it takes a lot more resources and money than anybody plans on using.
HealthySimAdmin, the predecessor, I've gone to a meeting called SimGhosts, and it was a very valuable experience, dollar for dollar. So we brought our admin person here, Eileen, as well as myself, and it has been a wonderful experience. We've been able to ask questions, we've been able to mingle and network, and the dollar for dollar, from an admin point of view, exponential.
So to be quite candid, I've kind of been using more of a general business approach to organizing the operation, but I've realized that even after those couple of months that I needed information that is more unique to simulation, and because it's a relatively new field, and especially for myself, I come from a very different business background. I felt that I really needed to go somewhere that was going to offer me the type of information that I really thought was critical in terms of getting the business model established.
For my role, I would say the utilization and getting people interested, the buy-in to come and use our center. I would also say some of the most important pieces were funding models. Now that we have our operational budget, what do we do with that money, and what's the best way to utilize it so that we can grow and be sustainable.
I've gained some good information on what I need to do better as an operations manager on data capture and 5-year plan versus a 10-year plan of rotating out equipment and having that in my annual budget.
I find that a lot of times there's basic understandings that even I knew before coming in here. We have to track data, how important is the data, but to really hear how the different simulation centers are tracking their data and exactly what metrics they're using and how those metrics actually vary between simulation centers, and how to be comfortable, for me to get comfortable with my own simulation center and gathering the data that's unique to us. I think also we're looking to go into a new simulation center on campus, because right now we're off campus. So to see even the structures of the different simulation centers and clinical labs and simulation labs and classroom space, I mean, things very basic like that have also been really helpful in terms of seeing how our structural setup can really guide the operation and make it and optimize the effectiveness and efficiency of it.
I would definitely recommend HealthySimAdmin conference either to people who are new, like our center is, or even people who are well versed in simulation, because there's just so much you can learn, especially being in simulation. You really are creating it from the ground up, regardless if you have been open for a while. There's always something to learn, especially with the different range of expertise at this conference.
I know that Dr. Greer and many of our other faculty have gone to several conferences, but I think it's been more of a clinical focus in terms of scenarios and simulation and how to kind of integrate that into the learning experience for students and residents. So I really feel that this was an opportunity for me to come and see more about a conversation that I don't think has been happening in simulation. And now, so after having been here, it's a saving grace, and I'm going back with such a wealth of knowledge, and I really wish that I could have done this 2 months ago, but I'm glad that it was early enough for me to where I can really implement a lot of what I'm learning here into the operation.
Absolutely. For any administrator at any level, you could be a hospital CEO and gain so much information and networking availability here. You could be a simulation specialist that supervises a few staff members. You could be even just someone who works around the simulation environment, wants to know more, and is hungry for information.